This video program is designed to orient you to the database for the Complications Registry, also known as the Sports Cohort Outcomes Registry, or SCORE. The goal is to ensure consistency and compliance with the data collection requirements as outlined in the Manual of Operations. We will cover the following topics in this program: logging in, data entry, follow-up, and reports. Additional resources are available by contacting score@tsrh.org. To locate the website, use your browser and navigate to www.abos.org. Please click on Login on the upper right-hand corner of the page. Your username and password are given to you by the ABOS team. If you do not have a username and password set up, please contact score@tsrh.org. If you have forgotten your password, please click on the recovery link here. Once logged in, look for the Registry tab located at the top right-hand corner of the page. You will be taken to the Registry dashboard. Your dashboard will have a list of all cases you have entered. You will not be able to view cases from other surgeons, only the cases entered by you. The Complications Registry database is both iOS and Windows friendly. We will cover 3 items in this section: adding a new case, entering a complication, and updating an existing case. In this phase of the program, we will review case entry. There are 4 case types being tracked in this database. To add a new case, click on the Add New Case link. This will redirect you to the case entry page. Enter your patient initials, patient ID, and patient age at the top of the screen. Continue along to complete the rest of the demographic, clinical, and surgical data elements. It is very important to enter accurate data, as the data entered on page 1 will determine what additional data elements are requested. At the bottom of the page, you will see numbers. These numbers correspond to pages of data elements that need to be completed for the associated case type. Please ensure all pages that appear are completed. The list of available ICD-10 codes is quite long. It is easier to type in the code if it's available to you. The page numbers at the bottom of the page may not always appear sequential. Only the pages that are required for the procedure selected will show here. On page 3, complications data will be entered for each case. The second column is where the complication description is entered. This is a drop-down list of all the potential complications that may occur. Additional comments can be written in free text in column 3. Treatment should be typed into column 4, and grade of the complication noted by the drop-down in column 5. The grade of the complication will follow the modified Clavien-Dindo classification scheme, which can be accessed by clicking here. Onset date, date resolved, and status need to be completed. At the bottom of the page, please complete the data elements relevant to the complications noted in the table. If no complications are noted at that time frame, please select None in the complication drop-down menu in the first row of the table. This will help those auditing the data recognize that the table was not missed. To update an existing case, navigate to the Registry dashboard. From here, you can click on the case number hyperlink to open the associated case for data entry. When updating a case, all data entered will override previous data permanently. In this section, we will review 3 items: how often you need to log in, how to enter follow-up information, and email reminders. For all case types, data needs to be entered at the following time points calculated from the date of surgery: perioperative, 2 months, 8 months, and 18 months. Additionally, all ACL cases require data entry at 30 months from surgery. Navigate to the Registry dashboard and find the corresponding case requiring follow-up data entry. You can open the data entry form by clicking on the case number hyperlink, or you can enter complications data directly on the dashboard. If a complication is noted and you click Yes, an additional section will pop up requiring you to enter details of the complication. All cases that do not have compliant follow-up data entered at appropriate time points will show at the top of your case list on the dashboard. The missing data elements will be highlighted in red. These are the high-priority items and should be addressed first. Periodically, you will receive an email from this email account. The email will look like this. If there are deficiencies in a record that need attention, there will be a hyperlink that takes you directly to the login screen. Please log in and navigate to your registry dashboard. Please add this email to your safe list to avoid reminder emails from being considered spam. You can run a report on your patients and corresponding data. To access the report, navigate to the registry dashboard and click here. Your report will download into an Excel format for your viewing. All participating surgeons have access to a report of their own case data. Aggregate reports will be compiled and reviewed at the biannual meetings. If you have additional questions regarding data entry, please contact score@tsrh.org. We thank you for your contribution to this exciting project.